Hello to sir and everyone. We are from group Pediatric. We will present about the portfolio of the Pediatric with the Scoliosis. My name is Fadlin Sakina and I will present about the introductions of the Scoliosis. Okay, what is Scoliosis? Scoliosis is the lateral curvature of the spine that are greater than 10 degree that can be seen through the radiography, and it usually associated with the trunk rotations, and the spine will curve side to side or with the C or S shape. And there are three types of the scoliosis, which is congenital, neuromuscular, and also idiopathic. And our group will present about the AIS, which is adolescent idiopathic scoliosis. And there are a lot of symptoms for the scoliosis patients, which is the head is not center with the body, and other is the uneven shoulder, and third, one shoulder blade is more protruding than the other one, and the rib is more prominent on one side, and uneven waistline that can be seen clearly through the scoliosis patients, and difference in their hip height. There is a symptom for the scoliosis patients. Thank you.
For the fascial problems, is C-shaped curvature on the spine, pain at the back when sitting and standing, right shoulder level is higher if compared to the left shoulder level, right shoulder blade is more protruding, and the right hip height level is higher.
So based on the passion problem, the short-term goal for our exercise intervention is first to decrease the pain of the spine, and then to decrease the imbalance and to reduce the deformity, and third is to improve the strength of the back muscle.
Okay, next is for the long-term goal. Firstly, to improve back posture, then prevent progression of the curvature, and lastly, to improve quality of life.
Okay, so I will continue for the exercise prescription on short-term goals. First is the pelvic tilt, second is cat and camel, then third is arm and leg raise, four is bird dog, five child's pose, and last is latissimus dorsi stretch.
For the long-term goal, our exercise preparation is first, side bending and side laying, second, squat cell exercise, third, side laying plus shoulder counter traction plus muscle cylinder, fourth is wall ladder exercise, fifth, ADL posterior training for sitting, and the last one is ADL posterior training for standing.
I will continue to the exercise for short-term goal, which is to strengthen the abdominal muscle. I will go to the pelvic tilt exercise for these scoliosis patients. First, ask the patients to lie down on the back and ask them to bend their knee and put their hand on their side. Okay, make sure the toes are pointed forward, and then ask the patients to pull the bottom belly in and the pelvic push toward the ceiling. During the exercise, we ask patients to continue breathing, breathe in and breathe out naturally, and ask the patients to hold the exercise for 10 seconds and relax to the neutral positions, and ask the patients to repeat the exercise 10 times for the 3 sets for each exercise. And if there is pain or uncomfortable, stop the exercise immediately. And if there is more improvement or no other symptom arise, we will increase the intensity for the following week.
Starting position, patient in the crow position where hand and knee parallel to each other. Then maintain tight abdominal with head straight. Subject take a deep breath in and lift lower rib cage, round the back and relax neck. As breathe out, lower the chest toward the floor and locking slightly upward. Final position is returned to the beginning position. Okay, for the cat and camel exercise, the prescription is 10 repetitions per set,
and 2 set per session and 3 sessions per week. For the arm and leg raise exercise, patient need to begin with lying in prone position with the forehead facing the ground. Then, the patient need to extend out the left arm over the head with the palm facing the ground and lift together the right leg straight in the air. Hold the position for 5 seconds and then repeat with another arm and leg alternately. This exercise aims to strengthen the lower back muscle, especially the erectospinal muscle, and it also increases the lumbar stability. For the arm and leg raise exercise, you need to hold for 5 to 10 seconds, depending on the patient capability, and then repeat for 10 to 15 repetitions, depends on the patient capability also. And then there will be 3 sets per session and 3 sessions per week.
Okay, next exercise is bird dog. The aim of the exercise is to relieve pain, strengthen back, hip and core muscle. Lastly, promote proper posture. For the procedure, firstly, begin on the hand and knee with your back straight. Second, place your hand directly under your shoulders with knee directly under the hips. Third, extend one arm straight out and forward while extend the opposite leg straight back. Just like the model, breathe normally and hold for 5 seconds. Lastly, repeat with the opposite arm and leg. Okay, for the prescription, 5 repetition to 10 repetition per set and 2 set per session and 2 session per week. That's all.
Next, the exercise for scoliosis patient is child's pose with the purpose of lengthening the spine, reduce tightness and relieve pain. Okay, so for the procedure is first begin seated on your heels, just like the model, and then stretch your arms and hands out in front of you. Bend your upper body forward and lower your chest close to your knees, and then continue to stretch your arms forward until you feel comfortable stretch and no pain. Take deep breath and relax as you feel your back and spine muscle lengthening. Then relax your entire body. So for the prescription of this exercise is 30 seconds per repetition, 5 repetitions for each set, and one set per session and 2 sessions per week.
This is latissimus dorsi stretch. For starting position, standing in neutral position by keeping feet shoulder width apart and the knees slightly bent. Then, both hands reach overhead by grabbing right wrist with left hand. In this position, then, bend slightly toward the right side until subject feel a stretch in the left side. Hold the position with one breathing, then back to the starting position. The starting position repeated on the opposite side.
So for the latissimus dorsi stretch, repetition is we can do 5 until 10 repetitions on each side, right and left. Then 3 sets per session and 3 sessions per week.
I will continue to the exercise for the long-term goal, which is side bending in side leg. This exercise is to improve the posture and find the symmetry for the spine. Okay, first we ask the patients to lie down on their right side and put the round pillow or towel over their waist, and ask them to slightly bending their knee. Okay, and put the hand straight. And put the head over the bottom hand. And for the upper hand, ask them to overstretch over the head. and hold for the 5 seconds and repeat this exercise for 10 times and do it for 3 sets. And ask them to breathe neutrally, and if there is uncomfortable or pain, stop the exercise immediately. If there is improvement or there is no pain or other symptom arise, we can increase the intensity for the following week. Thank you.
Next, the second exercise is cross sail exercise or standing between two poles. For the starting position, the patient need to stand between two poles, and then the patient will hold the left pole with the left arm higher than the right arm, and then begin breathing by expanding the left rib cage and maintain the corrective position. And then try to hold for 5 seconds and then breathe out. For the scrunch sail exercise, repeat for 10 to 15 repetitions per set, and do it for 3 sets per session, and do it for the 3 sessions per week.
First, the patient lie on the lumbar convex side. The lumbar convexity is supported to have aligned the spine in the horizontal plane. The patient leg is supported by a stool, and the patient right arm is supported on a chair. The prescription for the exercise is 5 sets per session with seat breath and 3 sessions per week.
This is side shift wall ladder exercise. For starting point, subject need to start with standing position in front of wall ladder. Initial position with both hands need to place on the ladder, and starting position of the hand should be in the same place. Then the subject need to shift his positions to the left side by reaching his left hand higher than place than right hand. The subject needs to hold the position for 30 seconds before return to the starting position. For the side shift wall ladder exercise, the prescription for this exercise is 30 seconds per repetition when the hand reach, and for the each repetition we have 5 repetitions for 1 set, 3 sets per session and 3 sessions per week.
Okay, for the long-term exercise for scoliosis, this is for the ADL, activity daily life postural training 1. Okay, so the purpose of this exercise is for relief asymmetric loading of the curve and then improve the body posture. Okay, for the procedure, first is the sitting position, and then lift one hand while straightening up the spine. Then make sure to place the one hand on higher place. Then hold that position for 20 seconds. Okay, for the prescription, 20 seconds per set and 3 sets per session and 2 sessions per week. Okay, for ADL, activity daily life postural training 2, the purpose of this exercise is to improve the body posture, reduce possibility of curvature progression and lengthening and corrected lumbar cavity. So for the procedure, first is on sitting position, then shift your body to right direction while straightening up your spine. Alright, then feel the lengthening of lumbar cavity and hold the position for 20 seconds. So the prescription is 20 seconds per set, 3 sets per session and 2 sessions per week. Okay, thank you.
Okay, next is for the active daily living postural training 3, cross leg standing. The aim of the exercise is to relieve asymmetric loading of the curve and improve body posture and reduce possibility of curvature progression. For the procedure, firstly in the standing position. Second, put left hand at the left waist. Third, put right leg across at the left leg. And then lastly, hold that position. Okay, for the prescription, 20 seconds per set, 3 sets per session, and 2 sessions per week. That's all. Okay, next is active daily living postural training 4, wall support standing. The aim of the exercise is to improve body posture and reduce possibility of curvature progression. For the procedure, first, in standing position. Second, put your right hand to your waist. Third, lean your left shoulder towards the wall. And lastly, hold that position. For the prescription, 20 seconds per set, 3 sets per session, and 2 sessions per week. That's all.